is Lung Cancer Awareness Month, and this morning we are joined live by Dr. Eric Swanson, a pulmonologist at Essentia Health here in Duluth. Good morning, Eric. Thank you for being here.
Thanks for having me.
It's an important conversation. Of course, November kind of represents the advocacy and awareness effort. This is a year-round thing we should all be taking into consideration. But for viewers at home, why is this month so important and a good time to check in with yourself and your own health?
Yeah, so lung cancer is the #1 killing cancer in the United States. It actually has more deaths related to it than breast, colon, and prostate combined. So very, high, very high mortality if it's not caught early. And so the whole idea behind this is to catch it as early as possible when it's much more treatable. Catch an early stage lung cancer, and the survival is in the 90th percentile when you talk about a 5-year mortality. But you catch it at a late stage because maybe you weren't screened, or we found symptoms, and much worse mortality.
So what does that look like? How often should I be going in and getting my screening done?
Yeah, so screening's not for everyone. It's mostly for high-risk patients. So you look at people who have smoked at least 20 pack years, so that's 1 pack a day for 20 years or 2 packs for 10 years. People who are between the age of 50 and 77, and they're either current smokers or they quit within the last 15 years. So you do that, and you take that group of patients, and it's a yearly CT scan. They come in, 5-minute CT scan, you lay in a tube, get you right out of there, you get the results, right away, and say, hey, there's some sort of nodule here, or it looks clean. We'll see you again in a year, and go from there.
How can I take care of myself now and take those preventative actions for my own health?
So #1 thing is quitting smoking if you are a smoker. This is a smoking-related condition. There are people who get lung cancer that are never smokers, and a lot of that is related to genetics and things that we don't fully understand right now. But if you are a smoker, that's the #1 thing that you can do. Or if you have a loved one that is a smoker, talk to them about getting screened and making sure that they're doing preventative care for their health.
Tell me about how advancements in technology have changed in form of treatment and even testing at Essentia Health in particular.
Yeah, so we have a couple of things going on. We have a nodule program. So we use an artificial intelligence that actually scrubs the medical record for these incidental lung nodules that get found on a CT scan that you had in the emergency room for your belly pain or whatever it is. In the past, those used to be found and often not acted on, and now we're able to find those early. We're able to detect them, reach out to patients and say, hey, you have this, we should really follow up on this. So we have this whole nodule program that manages all the incidentals, manages all the lung cancer screening patients, and triages them which way they need to go. So that's one part of it. Second part is we have a actual lung nodule clinic, which is led by physicians who are interested in that work. We all we see is people with lung nodules and try to say, is this one that's high risk that we need to get further diagnostics on, or is this one that we can maybe follow up with another CT scan in a few months or 6 months or whatever it may be, and track them down the road. And then lastly, we have invested in different types of diagnostics. So we've had robotic bronchoscopy at Essentia for the last 4 years. We've been doing these hundreds of times a year, trying to sort out what these nodules are so we can find them at the earliest stages. Before, we had technology that could get us into the lung but couldn't reach the farthest reaches of the lung, and so a lot of times we'd have to wait for things to grow in order to safely biopsy them, or we would just treat them without a known biopsy because you just couldn't reach it safely. And now with these robotic bronchoscopy platforms, you can reach much further out into the lung to biopsy this. And then lastly, when you talk about treatment options, we have different types of surgical options now available too. In the past, it used to be a lobectomy where you lose 1/5 of your lung. And now you can actually get wedge resections or segmentectomies where you take a much smaller portion of the lung, so you're left with a lot more functional lung tissue. So lots of stuff changing, in the early stage lung cancer.
Well, and time is of the essence, and this, like you said, helps catch things faster act quicker in the mind of the patient. Now, any signs or symptoms someone at home should be looking out for if they have any concerns or notices changes within their own body?
Yeah, so unfortunately, lung cancer often doesn't have much in the way of symptoms until
Okay.
it's kind of an advanced stage. There are people who might have an airway lesion that causes some bleeding, so they'll end up coughing up some blood, or people will start noticing that they're wheezing on one side versus the other, which means the airway is getting pinched. But for the most part, it's a pretty silent disease, and so that's why screening is so important, so that you can catch it early.
All right. Well, Dr. Eric Swanson, I appreciate you being here. Any last message to our Northlanders? Again, this is Lung Cancer Awareness Month.
I would say that it's Thanksgiving season. Everyone's going to be seeing their loved ones. This is a great time to talk about, hey, we care about you, we love you.
Yeah.
Go get screened.
Well, we'll dive into that another time because it is so true. We need to chat with the people we love, be honest, and take care of our health, but it does come from those conversations.
Yep.
I appreciate this conversation. It was wonderful to have you, and happy Thanksgiving.
All right. Thanks, you too.
We'll be back, North.